The content of this podcast is for informational and educational purposes only and is not intended to be a substitute for professional therapy or mental health treatment. While we are therapists, we are not your therapists. If you're struggling, please seek support from a qualified mental health professional.
This is Heavy Enough. We're your hosts. I'm Riley.
And I'm Alyssa.
Sisters with therapy degrees. So expect a whole lot of insight, a little tough love, and real stories from our lives. Whether you're driving in the car, out on a walk, or just lying in your bed, get ready because we're diving in. We'll come up for air at the end. For this episode, we'll get into women's sexuality and the history behind it. We'll talk about pleasure and how to voice your pleasure, communicate with partners, and get what you want. Be happy.
I love it.
Because we're pleasure human beings, and we deserve to have that.
Yes.
So,
okay. So before we jump into all of that, how we embrace our sexuality with ourselves, with our partners, how did this, if we go back in time a little bit, like what's the history and where were we years ago and why are we where we are now?
We were non-existent years ago, and that's
we were invisible.
I want to say that's dramatic, but that's not really dramatic. And so here's the history of women's sexuality. So 1800s, women, irritability or mood swings or anxiety with women was like essentially a diagnosis. And the diagnosis was hysteria. And so
in the DSM.
It wasn't the
name.
It wasn't a disorder, but it was the catch-all phrase for irritability, stress, anxiety. People, women and men, experience every day.
Yes. Okay.
So it's just like, how do we fix this mystical creature that's called a woman?
Yeah.
And so it's because, there's no research still to this day. We're so behind female anatomy, and just the research of sexual response cycles and pleasure is so behind with women. We're catching up, but I digress. Going back, hysteria. Doctors would say, this woman has hysteria because I don't necessarily know what's wrong with her or care.
Mm-hmm. And it was like a label they just would
It was a
on.
label. And how you would treat it was pelvic massages, aka your doctors would give you an orgasm every time you went to the doctor's office.
That's just so crazy.
And lo and behold, women were treated, which is hilarious to me. Just knowing that, just have an orgasm. You
need to go to the doctor to get it?
You need to go to the doctor to get it. And so, I just think the history is so funny now, being 100 plus years ahead of schedule.
But also, that's not that long ago.
That's not that freaking long ago.
No one could figure out, we don't need a doctor to do that?
It's not that no one could figure it out, is that no one cared to figure it out. No one cared. Women's pleasure or women's stress was not a big deal, for men. Because it was predominantly just a man's world, and women were living in it. And so, lo and behold, male doctors got tired of giving orgasms all the time.
Their hands got tired.
Their hands got really tired. So in came the vibrator. That's how the vibrator was invented, is sort of this tool to treat women with anxiety and stress and irritability.
Wow.
So from the jump, women's pleasure was medicalized as a problem, as hysteria. And now it wasn't until around the 1980s that hysteria as this catch-all phrase was taken out of the DSM. So it was in the DSM. And then, but slowly but surely, it started to get replaced with other things. So somatic symptom disorder is sort of a catch-all phrase taking place of hysteria.
Yeah.
And histrionic disorder, that.
Histrionic?
It's a personality disorder, sort of like irritability, and highly diagnosed with women. And so yes, I do think histrionic personality disorder does have a place in this world, but it sort of kind of stems from that world of hysteria. And so although it was taken out of the DSM, it was replaced with
other things,
more acceptable, language.
Okay.
Yeah. And so the point still stands too with like the medicalized, a woman is not perfect, she must have something wrong with her.
Yeah.
It's just purely not listening to women and their pain and what they're experiencing, and not feeling valid as speaking up for themselves or voicing something is off and I need help.
Yeah.
For example, like endometriosis, it's obviously a very valid, very extremely painful, very chronic problem in women, and the diagnosis comes years after the initial complaint.
Yeah.
And so it's just we're not listening or respecting the woman's voice.
Right. So, I mean, I'm thinking about just emotions in general, and my normal question of what are you feeling in your body and how much information you get from an emotional feeling or a physical pain, and how our bodies just talk to us in all these ways. And so thinking about period pain or period cramps, or thinking about anxiety, or thinking about depression or postpartum, or all these things, hormone imbalances, whatever, to just say they have hysteria, it's so minimizing everything.
Yeah.
Everything, anything and everything that we women can be struggling with.
Right.
Because it encompasses so much. Like I'm thinking about, period pain can be really intense when you have endometriosis, and it's just, you have hysteria. Which, again, that still is happening today. Maybe they're not calling it hysteria, but it's like, just take somatic for your
disorder. Yeah.
And or like postpartum anxiety, because you just had a newborn and you're like heightened protective mode and your hormones are out of whack, and sometimes you need to take different medications, or like there's real answers to real problems, whether it's physical issues in your body or psychological issues to work through something, trauma that gets brought up to work through, and instead it's like, nope, you just have hysteria or somatic issues, and we'll just not address anything, and so you're just everything's just overlooked.
Yeah. I mean, it's truly, everything is overlooked, and the position of a woman of carrying a child and birthing a child and then having postpartum anxiety, it's like, we need to fix her, not, let's listen to her. Let's listen to her experience and what she's going through, and how can we support her in this time, rather than it's just so medical, let's fix her because she's bothering me. Her sadness, her anxiety is bothering me. So we gotta give her a vibrator.
Just shut her down.
Shut her down.
And my hand doesn't want to do any of the work.
I know. I'm tired. I don't want to go to work today. Here's a vibrator.
Oh my God. Okay, so with that really quick, is there anything in your life, and I'll think about mine as well, where you have felt kind of the overflow of that mindset of kind of being dismissed or ignored in the doctor's office, or when you go for a checkup, or anything like that?
I don't want to speak for all women. However, I feel like it's a very common experience that I hear with birth control, whether that's, I have really, really painful period cramps. In the first, without a question being asked of how's your stress levels, how do you feel, what's going on in your life, it's, here's birth control, I'll write you a prescription. That birth control has sort of stepped in place of this catch-all.
Yeah.
Like, it's so many things could be happening, like I'm losing my hair, or I'm getting acne, or I feel so depressed all the time, or I have horrible anxiety. Let me write you a prescription for birth control.
Yeah. I remember that being something like, as a teenager, everyone being on birth control for their acne.
Right.
And then we're wondering why everyone's having a hard time having babies later.
It's the catch-all.
Yeah.
Because I think we're just not listened to. We're not respected in that way.
Yeah.
I think we have come a long way, clearly. However, like, Yes and no. Like the clitoris was just mapped out 2 weeks ago.
2 weeks ago?
2 weeks ago. Can you believe it?
2026?
2026.
Oh my God.
30 years after the anatomy and the nerves were mapped out in a penis, now 30 years from that, now it's just mapped out for the clitoris. And the reason why this is so important is, well, again, going back for history, the clitoris is the only organ in both male and female bodies that is the only function is for pleasure. There's no other function for the clitoris. And so in that regard, it wasn't studied, it wasn't respected, it was ignored by researchers, scientists, doctors, everywhere. And so
because there's no point.
There's no point.
Yeah.
And female pleasure doesn't matter that much because it's more so what can the female do for the male pleasure. And so there's a lot of societal and nuances to that. However, why it's super important is because there's genital cancers, there's uterine cancers, there's ovarian cancers, there's pelvic surgeries that happen in the woman's body. And if you don't know the anatomy or the nerve endings, all the intricacies
and what's connected to what,
if you just open up a woman's body to treat some sort of medical disease, like cancers, whatever have you, you can completely cut up the clitoris or damage it or
the nerves
take her pleasure away because there simply is no research on it. And so it's just the ignorance of female pleasure is just put aside. And the clitoris is much bigger than we think it is. It's not just the head, which is the part we can see, the bean, the button. It's not just that. Like it's 80% of the clitoris is internal. You can't see it. So you're probably going to cut it up or damage some nerve endings if you don't know anything about it.
And I'm sure that's happened to so many people.
And how horrible.
Yeah. I'm thinking like, you said like ignorance of or minimization of women's pleasure. And I'm also thinking about minimization of women's pain, which we kind of talked about already, but I'm thinking about when I went to get an IUD put in and it was so like nonchalant, like no big deal. Like there was no prep for it. There was no take medication before, do some meditation breathing. Like, so I like looked up like what to expect. And how painful it is to put in. And I end up like looking up certain things for just like regulating my nervous system and like doing breathing exercises. And I go in and first of all, the lady, the OBGYN's like, there's a thing you can do where you squeeze your inner ear right here. And that's supposed to like calm something down. I don't know. That was what she told me. 2024-ish? I don't know. Not recently. Okay. Squeeze your ear, and that will help with the pain of a copper IUD going up you, basically. Okay?
Shut up.
And I'm like, okay, so I'm sitting there squeezing my ear, taking deep breaths. I can't even describe, and I know people have had worse.
Wow.
But it was like inhumane.
Really?
Like I was like, this is happening with me awake. And I've been through surgery, and I've been through biopsies, and I've been through blood work, and I've been through IV. Like, I've been through some shit. And that,
to say the least,
I'm like, we should be put asleep for that. At least with that experience. And I left, and I'm like, it was like a traumatic experience.
Wow.
And for it to just be like another person getting in, no prep. Like, and I prepped myself knowing what am I to expect and trying to get myself like mentally there, but like someone else with just the way they treat it, like it was just going to be like a Band-Aid and you're going to go home. It's like, that shouldn't be happening nowadays. We have way too much like researched like things to do to help someone, even like a Xanax. You know, like anything, like there was nothing offered. Pinch your ear, just pinch your ear.
I'm sorry. I've never had an IUD put in, but I've heard from your story, many other stories. It is so painful, and it's just simply brushed over. It's like just in quick for a doctor's appointment, and you'll be on your way. not only like the physical pain, but the mental just like toughness of trying to do that by yourself.
Yes. And I think that's a big part of it is the physical pain ends. Like when it was over, it was over. I didn't feel, I mean, I think there was like a little bit of cramping at one point for that time, but the emotional pain and the, like, it was just the experience of like, no one prepped me for what they were going to, I don't know.
Yeah.
It was just like, I can't, it was like something I had to like work through and relive a little bit and like talk about to be like, okay, that is now gone. So,
you know what? I do have a problem too. And I'm sure it's not the doctors essentially. Well, I don't know. But you have 15 minutes for a doctor's appointment, right? Like that's what they're contracted for, they're paid for. And coming in, I just remember a time where I was almost due date time, went into my OBGYN, normal, like every week appointment. And I just come in, she's like, how you doing? And I'm like, to be honest, I'm feeling like really anxious because everywhere on my social media, I'm seeing like stillborns or people losing their baby. And it's just bringing up a lot for me. So can you just talk to me about like the statistics or whatever?
Yeah,
she's like,
kind of comfort.
Yeah. And what she said to me, and this was last year, 2025, she's like, oh, I just mute all those pages on Instagram. So here's how you do it. On Instagram, you go to this button and you say like, mute these kinds of accounts.
No.
So talk about being dismissed of a very real woman experience.
Yeah. And this is a woman doctor?
This is a woman doctor. Yeah. She is very by the book of the 15-minute.
Yeah.
So I'm not shocked by her response and, like quick out the door. I need you to be gone for my next patient. I was just shocked at I don't know, validating, like, yeah, this is really scary. Also, your hormones are completely out of whack and your body's about to go through a very traumatic thing.
And you think about worst case scenarios.
And of course you think about,
there was no empathy.
No. Going back to like the history of women's sexuality. It started as like sexuality being pathologized like in the 1900s. So it started medicalized. Then it went to shame because then we entered like the 40s and 50s where you have like the good housewife, pleasure your husband, have sex with your husband only, and it's about his pleasure, not yours, and
do your duty.
Be desirable only from your husband, not from anyone else. And it's just so much of this pressure to be only sexy for your husband, but don't let anyone see or hear and forget about your own pleasure.
Yeah.
And so we went from just a lot of stigma then to sort of the 60s, 70s, where it was like this sexual liberation. Birth control, only women's birth control came into play. And so now it was no longer no fear of having children or reproducing because there's a birth control. But then you have like the influx of STDs and all of that. And so there was no education.
Yeah. And I'm thinking influx of side effects. Women are the ones having all the birth control.
100%. Yeah.
And it's all side effects for us.
Right. Yeah, I swear when I went on birth control, how old was I? I think it was like, I had cancer when I was 12. They put me on birth control to stop my periods because I couldn't lose blood. Like you need to keep as much blood in you as possible because you're losing blood cells. So I was put on that like automatically then, and it stopped my period. So I was on a heavy dose probably of hormones because it stopped my period completely. And then I was on that for a few years after. I was going to say I lost my hair, but I didn't lose my hair from the birth control. I lost my hair from the chemo.
Yes.
But when I grew back the hair, I went on a new kind of birth control, lost half my hair there. And so like the symptoms.
From the birth control?
With birth control, yeah. But
interesting.
I think there's different symptoms for each person. So yeah, talk about the side effects. Like no one cares. They're like, oh, you care about your hair? I don't know. Like we've talked about this multiple times. We've both have lost our hair and what that has done to our identity and how we feel about our femininity and our own sexuality as women. Yep. And so it plays a very important role, but no one cares.
Doesn't matter.
So anyways, in comes the research around the 60s, 70s as well, with Masters and Johnson kind of were the first ones to study the female sexual response cycle and make pleasure and the clitoris a name in a book and something to be studied. Just because it started then obviously wasn't like, oh, now we can respect this thing. Right. Now it's real to us.
No, this is like the beginning.
This is the beginning. Yeah. It was the 60s, 70s.
Totally.
Going to 80s. So fast forward to now, like I said, 2 weeks ago, they finally mapped out like the clitoris and it's giving some sort of recognition for female pleasure. And now we're starting to become more liberalized. Is that the right word? Liberated. Wow.
Liberated.
Yeah, starting to become
liberalized.
Liberalized.
Go together.
Did not major in English.
You don't have mom brain. You can't use that. Well, you guess you have mom brain. You don't have pregnancy brain.
True.
You do have mom brain.
True. We're a little bit liberated now in terms of being able to talk about female desire. Emily Nagoski, too, she really talked about the spontaneous desire versus the responsive desire.
Okay, I want you to talk about that a little bit because I feel like that's something that is really important for people to hear and know when they're thinking, working with couples and things like that.
Working with couples, I have always run into desire discrepancy when working with women talking about their partners or couples. Very rarely is a couple ever on the same page when it comes to desire. Responsive desire is more prevalent in women, meaning you see or feel or hear the stimulus first. That kind of intrigues some sort of like, ooh, that's hot, that turns me on. Then the desire comes. Desire often-ish is not the first thing to come. So I hear a lot women, I don't know why, I'm not in the mood. Talk about the stress and the anxiety and just the real life stressors of men and women going on. But you get this, I just feel so bad. Like I'm just not in the mood. He does all these things for me and I can't get there, or, there's no like emotional connection. And so it's hard for me to even like get there with the right stimuli. And so Emily Nagoski really brought to light, she's also a sex therapist. The spontaneous desire is the like, I'm ready, let's go. And more prevalent in men. And we still live in this male, gay-centered society. And so everyone then should have spontaneous desire because men have it.
But it's also something that's like in movies and like social media and you know what I mean? It's like we all think we need to perform in this certain way or feel this certain way, and if we don't, something's wrong with us.
Yeah, absolutely.
And so what you're saying is like, no, you might have responsive, which is sex starts in the kitchen or whatever that phrase is, where it's like, no, it's builds up off different things, conversation, you're needing something else to get you there.
Right, absolutely. Yeah, oftentimes the arousal or excitement period starts first before the desire comes. And that no one talks about that because it's
work,
not as prevalent in males. And it feels like, oh, well, I'm just not in the mood, so don't touch me and respect that. Which, yes, like consent absolutely matters every single time, but allow a little leeway in terms of be curious. Like if there is consent and your partner does touch you in the way that you like, but you're not in the mood at that second, be curious, maybe touch him back in the way that he likes or touch her back in the way that she likes. And lean into it a little bit more and see if that desire comes up. If it doesn't, then, no means no.
Right.
But Emily Nagoski also talks heavily about the accelerator and brakes in stimulus or liking something, not liking something. So let me go back. Knowing your accelerator and brakes in your partner and in yourself is extremely important because, for example, an accelerator can be emotional connection or deep conversations or touch on the inner thigh, not the outer thigh, whatever. Right. Those are accelerators. Those get the desire and the excitement period moving a little bit. Now, the breaks can be stress at work or I get home and the trash isn't taken out. It could, it could be anything. It could be anything. Yeah. And so if couples come in and say, we're just mismatched desire, she's never in the mood, she doesn't like me, I can't handle it anymore, my needs aren't getting met. She comes in with, well, all my brakes are being pushed and none of my accelerators, is getting pushed. So take the trash out or ask me how my day was or take the kids out. Get me out of my to-do list. So oftentimes the mismatched desire is purely just, I'm exhausted and my needs are getting met outside of intimacy. Yeah. And two, I've had a couple one time where it's like they come in and she's like, yeah, and he just took the dishes out of the dishwasher without me asking. And I was like, wow, take my shirt off right away. Yeah. Like he really pressed on her accelerator and that built up that emotional safety, security enough for her to start to feel that desire. That's so funny. Yeah. So I feel like that was such a roundabout way. But I like the accelerator break idea. And I think of it like that, I don't have to say like, oh, it's a strategy in a game, but it also, there's so much more like insight into your partner and what's going on and learning each other. And there's a lot in that. Yeah. And two, I want to emphasize, it doesn't just need to be with a partner. Like it could be like one night stands or friends with benefits type of situation. Like it doesn't always need to be this like deep emotional connection for your accelerator to be on or you to have desire. Right. You can simply just like novelty and excitement and going out on a date to a new restaurant with this new person. Yeah. And so it doesn't always have to be so deep and emotional for you to have any desire. It's very, very prevalent, the desire discrepancy. Yeah. What about like performance versus presence? So like during intimacy, how the mindset is, and you talked about this a little bit with like men's pleasure versus women's, but how do you work, like do you see that with your couples and how do you work with that? Yeah. So, performance anxiety is such a real thing with both men and women. They both have their own stories. Since we're talking about women's sexuality in this episode in specific, we come from a history that women please men. And we also come from a history of penetration is the way you have sex. Now, hopefully most people know now that's not the only way to have sex. Like sex is a lot of things. Foreplay, and it starts in the very beginning. Like I said, foreplay can start at 10 a.m. by you unloading the dishwasher. Like that is where those feelings kind of start. Yeah. And so we come from a world of Freud, which is like, he did us dirty, really, of talking about orgasms in women, which no business of him talking about that. But he talks about mature orgasms and immature orgasms. Mature orgasms is only through penetration and vaginal orgasms, whereas immature orgasms is external or clitoral. And how much of that is just BS? Mind being like, how much of that is premature? I just want to stick my penis in you, and then that's considered maturity. Then you're grown up. Then you're a grown up, which is funny because obviously you knew nothing about the clitoris, because the clitoris, like I said, 80% is internal. Inside. Yeah. And so a G spot, you're rubbing up on the internal glands of the clitoris. Like it's still a clitoral orgasm. Yeah. Like there's no really such thing as vaginal and clitoral. Like it's all one thing. It's all one system there. Yeah. And so so we come from that history of penetration is sex, and that's how you're going to get pleasure. That's how men get pleasure, right? For the most part. So going off to your question of the performance, it's what can I do to please the man? That's the history and the system that we're coming from. And so, am I doing this right? Is he satisfied? And I'm saying he in a lot of this because we've come from a binary history, and it's always been men-centered through the male gaze, and so that's why I say him. But what can I do for him? How can I look sexy for him? What does he like? Does he feel good when I do this? It's never, how do I feel? Right. How does my pleasure get a little notice in this interaction? Yeah. It's always about what women can do for men historically. And so just now recently, like I said, we're coming out of that mindset, but it's still, I mean, we're talking about women having to fight hundreds of years of oppression about their own pleasure. Yeah. So and it's going to take time.
Pleasure, but yeah, their own bodies, emotions, it's all of it.
It's
all of it, just being like connected.
Yeah, absolutely. And media doesn't help either. Like, I mean, especially porn, it's always about how sexy and how hot can women be for men, and men get off on female pleasure. And so it's not about her feeling the pleasure, it's about him witnessing her feeling the pleasure. Right. And that is good for him. Good for him. So yeah,
and that's media, what we're competing with.
That's what we're competing with. Yeah. Right.
Damn.
Yeah.
So we're all screwed, is what you're saying.
No.
Just kidding.
We're on the right path. We are on the right path. So it's just going to take a while. So give yourself some grace. If you feel just like this constant pressure to be performative, because we have always been performative of what we can do for others.
Yeah. Yeah. I'm also thinking, I mean, personally, I feel like my history with all of this has been more rooted in like shame with sexuality. Yeah. Growing up in like church and messages I got from like youth group and things like that. So I don't know. I mean, yes, the please the man mindset. I mean, that's my family for sure. That is there. Not like, not even just talking like sexuality, but more of just like
a patriarchal.
Serve the man the dinner, and like it's just very much like male centric, and women serve the men. But then also, like I said, like the shame around it. So, I mean, I remember being 14 and having like pastors come and speak to my youth group, men, like boys and girls, and just different stories of, and this is not just my church, like this is something I've bonded with other like adult like Christians who grew up with this, like stories of, okay, so you are a flower and like this is you, and I'm gonna like the image is like I'm gonna pass around this flower, and everyone who gets the flower, I want you to pick a petal off. And so they would do this imagery, and he'd come back and he'd come, like they bring it back to the front and there's like one petal left. And he's like, okay, so what I just did, I want you to think about like before I pass it around, that's you if you're pure and you have not had any sex before. And everyone who picked a petal off, that was like being intimate with someone. And so now look at you. This is what you look like after that. And so it's just like, now you're not a flower. Yeah, I mean, I'm paraphrasing. For sure.
Yeah.
But that was
that's a message you received.
Message is like, you're no longer pretty. You're no longer a flower. You no longer have worth. You're this ugly stick now because you gave your body away.
Right.
And I think for me, I don't want to swing a completely different direction of like hypersexualization, because I feel like that's what can happen. And just like, I don't care, and like my body's nothing and my energy's nothing, and like I don't think that's the answer either. But that was not the message to tell a 14-year-old girl who's scared of going to hell. Like, because then it was like, like, I mean, fast forward to my adult years, it's like, I'm in trouble, you know?
Yeah.
So anyways, there's that message. There's another one about gum. Like when you're pure and you don't have any connection or any intimacy with anyone, you are saving yourself for marriage and your husband, your one and only, that like there's one person for you. You're sticky like gum, and you'll be able to bond with them, and you'll have a beautiful marriage and nothing will go wrong. Like which is like so inaccurate. And then if you have sex or if you're intimate with other people, it's like chewing the gum over and over and over, and then you lose the stickiness and you can't bond with your husband, and like your marriage is ruined and your sex life is ruined forever. And so
your only worth is what you can do for him sexually. So you better be the perfect tip-top, no-touch shape.
Yes, it's what you are able to provide your husband. I mean, I remember my friends like having sex for the first time and telling me, and one of my first friends who shared with me, I started crying.
Really?
Because I was so sad for her life.
Really?
Yeah. Wow. I was like, oh, it's like over, it's ruined. Like I was so like, oh, she, and I don't know, like I was like, I carried this weight of just like, that was like, there was like no grace for it. You're doomed forever. Anyways, I could go on forever about that.
Yeah, topic, I mean, but thanks for sharing that, because I think that's very prevalent, not just for Christianity, for religion in general. There's a lot of like religious trauma within, and like sexual trauma within religion too. It's I feel like those go, unfortunately, like there's a lot of stories that combine with that. But I'm curious as well, do boys growing up in that environment, in that religion, receive the same messages? I have no idea. But it's interesting though, because during my sex therapy certification, one of the professors asked, okay, write down as many nicknames, and this is what I'm telling a story because you reminded me.
Yeah.
Write down as many nicknames you have for the vulva, for the vagina. And I could list a whole sheet of paper, maybe even the backside. Just talking vagina and vulva is so like just not as accepted. And they were like, and then on the flip side, they're like, okay, now write as many nicknames you have for a penis. I mean, I have a few.
Yeah.
But there's, because like you said, the flower analogy, like the petunia and the flower, and it's all these light and kitty and like cutesy names other than the anatomy for what it is. And so I don't think that came out of nowhere. Like those messages are shared with you as, oh, this is delicate, this is a cutesy thing.
I'm birthing a baby out of there. Are you kidding? Yeah, like my petunia about to open wide open for you. But my petunia.
But you get these messages that you're cute and pretty and nothing, you shouldn't pick it at all, and don't even acknowledge it for what it is, which like we wouldn't call your arm a noodle. Like it's your arm. Like it's the same anatomy. And we have just been socialized to
be shamed. Like we feel shameful about it. Even like teaching like kids the names of it. It's like, because for some reason it's like, oh, we don't want to say vagina. Like, like it's a bad word.
Right. It's a bad word. You hit it on top of the head.
Yeah,
exactly.
It's a bad word.
It's a bad word. So any parents listening, normalize the anatomy, because then it's not so shameful and stigmatized. And a bad word. It's a penis and vulva. The vagina's inside, the vulva is outside. Anyways, I mean, working from a biopsychosocial model, oftentimes, I mean, social religion and other groups, I mean, play a huge role on sexuality and pleasure too.
Yeah, because and especially like if you're not getting taught from your parents, which a lot of parents shy away from it.
Yeah.
Because it's like, oh, I don't want to teach them about sex.
Right.
Or teach them about their bodies. Where are we going to learn?
Well, oftentimes they weren't. So they really don't know.
True.
Like talking about, give yourself some grace too, because we have come from hundreds of years of not talking about it and it not being recognized. And not having the language to be able to name it.
Totally. Yeah. But I think as parents, remembering, like, if we don't teach them at the appropriate time, like, they are going to figure it out or find out on their own. And that might be through not good messages at church. It might be through porn, which isn't going to be helpful, or movies. It's like, we have to be, if we weren't taught, we have to teach ourselves now. And then we have to, like, pass the truth down, as opposed to just letting, like, whoever teach them.
Right. So. Exactly. And teach, honestly, more of the like psychological factors associated with sex too, because because there is so much shame and stigma, specifically with women, there's going to be a lot of anxiety or stress or body dysmorphia too. Like, well, my vagina, my vulva doesn't look like my friends, or I have so much shame about how it looks. It's like, what? Like, it's just like, it's...
Yeah, my elbow doesn't look like your elbow.
But
like,
no one cares. No one
yeah.
cares about that. It's because that part of our body is just so like private.
Yeah.
And we can also teach healthy ways to think about it, healthy ways to talk about ourselves, healthy ways to use our body with other people, healthy ways to respect our own body, respect other people's body, talk about other people's body, and sexuality and pleasure. And so there's a lot of healthy things that could come out of purely just education about yourself.
Yeah. So earlier I said, okay, so we're all doomed. And you said no.
Yeah.
If there is someone listening who's feeling either scared or disconnected from their body, or I don't know, there's so many different scenarios. Like, where do you feel like they should start in terms of like reconnecting with themselves and their sexuality?
Yeah. Well, I would say for women, first, look at it. Like, be curious. Sit down on your bed, grab a mirror, sit in front of a mirror, like explore your own body, because how can you advocate for something when you are nervous or scared to even look at it yourself? Know yourself, and that includes what it looks like and how do you find pleasure. I know masturbation is, especially in like a religious world, is not accepted. I'm gonna say like, nope, like masturbate, know your own body, know what feels good to you, know how to communicate that. Because if you are seeking pleasure and want it, but don't know how or what to say, you got two hands. Like, you have all the things you need to be able to know yourself, and therefore respect yourself, and being able to talk about what you want to other people clearly and in a way that you feel confident in doing. Because I think a lot of the times too, I hear, well, I don't feel satisfied in my sex life. Well, what do you like? Well, I have no idea. I don't know what I like. I've never been allowed
to ask that question,
to do that or ask that question. And so exploration, curiosity, look at it, learn the anatomy of it. And also I think there's a lot of mixed messages out there about female anatomy and like sexual response cycle and lubrication. And there's all these, well, I have to be super wet, or why aren't I wet, or it hurts and I'm just gonna stick through the pain because I'm too scared to say like, stop, it hurts. Pain is never normal during penetration ever. And so a lot of the times you're not giving your body enough time to kind of get there. I know a woman oftentimes are feeling like rushed, like they have to hurry up and have an orgasm because they don't want the man to like get tired, or again with the doctor, like their hand hurts or whatever. We're constantly taught to think about the other person. Oftentimes sexual dysfunction, and you don't have to have a sexual dysfunction to be able to figure yourself out. They're 80% psychological and about 20% biological. So there's a lot going on in your mind.
Yeah. I was going to say too, like, I think a lot of times when it's like women who aren't interested in sex or liking sex, or it's like you're saying, it's not always like something's physically wrong. It's like, let's look at like all these other factors, like the accelerators what you were talking about before, where it's like, how does this look? And opening it up of like, what is the day-to-day, breaking down in like small pieces of like, what does your day look like? And like, why is that not something that you are open to, if that's what it is? And so I'm like, even that, just thinking about the doctors and like anxiety, depression, whatever, all these symptoms, and then it's like an orgasm fixes it. Like sometimes it's kind of like that same idea where it's like, you just need a nap and a snack and you're going to feel better.
Exactly.
Like, you might just need an orgasm, and like, we don't need to think so hard. You don't need to like think so hard or talk it out. Like sometimes you just need that.
That's a great point. Yeah.
You know? So I don't know. That's just what I was thinking about. So
yeah. There are a lot of things you can do, along with the 20% biological portion, though. Like, go to your doctor if you feel like things are off or whatever. There are medical reasons why you could not feel pleasure, get there, lubricate, I don't know, pain.
Yeah.
There's a lot of things medically that could be going on. So I would say go there, get that ruled out, and then come see a therapist, a sex therapist, even just talk to your partner, try orgasming on your own and figuring your own self out before you reach to others. But there's a lot. I mean, I say too, like, your brain is your biggest sex organ. It can absolutely hinder your experience, or it can make it the best experience of your life. Yeah. And so really working on that mind-body connection and knowing that there's a lot of extraneous factors in your life, stressful or not, that could be adding to the lack of pleasure, the lack of sexual satisfaction, pain, I don't know, anything like that. Those are so important, not just to brush away. Right. And like, as women, we were socialized, just brush those things away. And know 80% of probably why you don't feel your best sexually is because of your brain and because of things going on in your environment.
Yeah. It's like, be curious about what you're going through as opposed to ignoring it.
Yeah. And don't be so judgmental. I think women are quick to, women and others are quick to judge ourselves for not being like perfect and like primed always and lubricated and ready to go and desirable. So have some grace for yourself with that.
Yep.
Yeah.
Awesome. Thank you.
Of course. I was gonna say, research has a long way to go, society has a long way to go, but we are getting a lot better. So don't be the first one to like judge yourself on being perfect, because
we're all in it together.
We're all in it together.